right. Hi there, everyone. Let me get these two-ply masks off. Hi, I'm Rendy Murphy. I'm an epidemiologist and the Director of Disease Surveillance at the Mobile County Health Department. We're doing Facebook Live today at 2:30 from our new pop-up clinic at the Bel Air Mall. And Erin Coker, our Emergency Preparedness Coordinator, is here to tell you a little bit more about that after I run the numbers. So again, yesterday, sort of play, rewind, repeat, seems like another record number of COVID cases reported to us yesterday. So we went over 50,000 cases of COVID-19 for the first time since March of 2020, when the pandemic first arrived in Mobile County, when our first case was diagnosed and reported to us on March 19th, 2020. So since then, we have recorded 50,516 cases of COVID-19. Yesterday, a record number of 669 cases were reported to us in one day. This is not a backlog or anything other than just what we are seeing from an incredibly fast number of cases. It's okay, Mark. Yeah, it's fine. The incredibly high number of cases and transmission that's going on around the county. So yesterday in the hospital, there were 332 people in the hospital yesterday. Again, that is far beyond the highest number of people hospitalized on any one day that we had seen back in January. So this for sure is the worst part of the COVID-19 pandemic for Mobile County. We are not seeing any leveling off. We are continuing to see rising case count, rising number of hospitalizations. We are having more deaths reported to us now, so that's getting a bit concerning, although it's still much lower than the death rate that we saw in the winter. So I will answer a couple questions, but first, Erin's going to come on and tell you about our pop-up clinic at the shops at Bel Air. Erin.
Hey everyone, I'm Erin Coker, the Emergency Preparedness Coordinator for Mobile County. I am an RN and one of the kind of site managers for this new pop-up clinic that we have at the shops of Bel Air. So we are located in the old Forever 21 location, and that building is right in between H&M and Dillard's and the Chick-fil-A food entrance, if you know where that is. So today we plan to open at 2 o'clock and we're going to run until about 7 o'clock tonight, and we had people already in here getting tested at 12:30, and we have done about 35 to 40 tests already since we started, and we're at about 5 to 7 vaccines since we started. So we encourage everybody to come down here, get tested if you need to. We also have two other locations. One is at our New Bern Clinic, which is 248 Cox Street, and they're there until 3:30 Monday through Friday. And then our Keeler building, which is 251 North Bayou Street, which is 9 to 3:30 there as well. We opened this additional site to provide some more capacity because we are kind of being overwhelmed with tests, so we wanted to make sure we had enough staff and space to provide what our community needs. So we welcome you to come down here and see our staff and get tested, and if you're negative, we encourage you to get the vaccine as well. So we look forward to seeing you, and we will be here Thursday and Friday also from 9 a.m. to 7 p.m. Thank you. Have a good day.
All right, thank you, Erin. As Erin said, this is opening up this clinic is just another way that the health department is trying to serve our community by providing free walk-in, no appointment necessary COVID testing and offering free walk-in, no appointment necessary vaccine. Any of the three vaccines can be, we can give any of the three vaccines here depending on eligibility and age requirements, that sort of thing. Again, Erin mentioned that our two Monday through Friday clinics have just been inundated with people needing to get tested, attributed to the incredibly high level of transmission going on in the community, and lots of folks concerned about their potential exposure and wanting to know if they're positive or not. Again, record number of cases yesterday, record number of hospitalizations. And just to remind you, we have totally eradicated some diseases like smallpox. For the most part, all but in just a few very small parts of the world, there is no more wild-type polio transmission, and all because of really safe and effective vaccines. So we want you to, protect yourself, protect your household and your community by getting vaccinated. Just a couple of questions came in from yesterday. I announced yesterday that the state health department had had adopted a policy to require consent forms, COVID vaccination consent forms, for anyone between the ages of 12 and 18. and if that was something that was new, and that the Mobile County Health Department would be following suit in that. So if you are between 12 and 18, you will need a consent form, and we've had a couple questions about where you can get the consent form. So there's not a special consent form for parents, but the vaccine consult forms, or the vaccine consent forms, sorry, can be found on our mchdcares.com website. There is a tab at the top that says vaccination consent forms, and if you click that form, you can complete it and sign in advance for your child if you're a parent wanting to send your child to get vaccinated without you. Let's see. Another question someone was asking about the monoclonal antibody infusion treatments, wondering that's a treatment for COVID, and they were asking if it might prevent COVID infections, and it does not. So that is a treatment for COVID, not a preventive measure for getting COVID infection. Also, someone asking about homebound vaccinations. We had a homebound, we were able to have a homebound, an in-home vaccination mission when we still had the National Guard activated and working with us. Since that team of 10 has left, we've not had the resources to be able to give homebound vaccinations, but we are working on it. So keep asking us, and we will let you know as soon or if we're able to provide that. We're also working on a transportation contract, so that if transportation is a limitation to getting vaccine, getting from your house to a vaccine location, we're trying to work on a solution for that as well. But we understand that some people just are not able to leave their home because of health or other disabilities. All right, so I think that is all of the questions for today. Are there any that have come across, Mark? All right, so thanks to Aaron Coker for joining us today, and thanks to everyone. I'm coming to you from in the back of the space at the old Forever 21. We're calling it our COVID 21 clinic because it seems appropriate, since this was Forever 21. Now it's 2021, and we're giving COVID vaccine and tested, so we'll start calling it our COVID 21 clinic. Thanks to everybody who came out and who's sort of taking a step away from their normal job that they do for us every day to come and get this pop-up vaccine clinic going, and working. Seems to be a success already. So thanks everyone. Be safe. Please get vaccinated. Please wear your mask when you're out around anyone outside your household, and maintain your distance. That's the only way that we're going to be able to start curbing the transmission in Mobile County, and hopefully get to some leveling of just the enormous record number of cases and hospitalizations that we're experiencing. So be safe out there, get vaccinated, and we'll talk again tomorrow.